The UK hospitals say they've been overwhelmed by the recent surge in COVID-19 cases. Health officials are concerned that any reprieve for hospitals won't be felt for at least another 14 days.
With the COVID situation in London now declared a major incident, concern, like the virus itself, is spreading. Government advisers are suggesting that the current rate of infection could be as high as 150,000 new cases every day. It's putting a huge amount of pressure on the NHS.
There are more patients than we've ever had. We've had less staff than we've ever had. And it's not just the intensive care units, the hospital, the wards run by our respiratory physician colleagues, our geriatricians, everywhere is full beyond bursting. Staff are breaking themselves to make this happen and to keep our patients safe. And it's not going to be enough.
When 34 million people moved into Tier 3 on December the 16th, there were over 15,000 COVID patients in hospital beds in England. That number had risen to 17,701 by Christmas Day. It's now over 29,000. We're now in our third period of lockdown, and in the past these tougher restrictions have shown to reduce the number of COVID-19 infections. The concern is that it takes at least 2 weeks for any impact to be seen because of the incubation period of the virus itself. So of course the NHS are worried that they need to get through the next week or 10 days at least before the benefits of this lockdown will hit the wards. In Sheffield, as they are across the country, health experts are hoping the rollout of vaccinations will also soon begin to ease the pressure, not just to prevent more virus-related deaths, but to allow non-COVID patients to get the life-saving treatments that they need.
In the spring, we noticed that people were not coming to hospital, and we need to make sure that everybody's healthcare needs are considered this time. It isn't just about COVID, it's about everybody else who needs to access the NHS.
In response to the current situation, a government spokesperson has told Sky News, our NHS is facing a huge challenge and we continue to support it in every possible way. It's absolutely paramount people in London and the rest of the country follow the rules and stay at home to protect the NHS and save lives. Winter provides the perfect storm for the NHS as rising infections are exacerbated by the flu season. But the combination of lockdown restrictions and the vaccination programme provides some light at the end of the tunnel. The hope is that the tunnel will be a short one. Fraser Maud, Sky News, Sheffield.